Hello everyone, welcome to this session. I am Dr. Singh, and in this session I'll be discussing the management of jet lag. Jet lag is best understood as a circadian misalignment disorder. It occurs when the body's internal clock is no longer synchronized with the external environment after rapid travel across multiple time zones. Because the circadian system regulates sleep, alertness, hormone secretion, and performance, this misalignment may lead to poor sleep, daytime sleepiness, and impaired functioning. Management begins with a detailed history. We need to know the direction of travel, the number of time zones crossed, baseline sleep habits, and prior responses to treatment. Understanding circadian physiology is essential because in jet lag treatment, timing matters more than dose. Successful treatment of jet lag is not a single intervention. It requires a multimodal approach. The goals are simple: to improve sleep, promote wakefulness during the day and when needed, and to accelerate circadian adaptation. Under natural conditions, the circadian system adapts slowly. On average, it takes about 1 day per time zone crossed for full adjustment. This is why jet lag symptoms can persist for several days. Treatment does not eliminate this process. Instead, it aims to speed it up. The direction of travel determines which strategy is needed. A phase advance means sleeping earlier and waking earlier. A phase delay means sleeping later and waking later. Light is the strongest circadian signal. Bright light can shift the internal clock, while dim light or darkness allows sleep to occur. Melatonin acts as a signal of darkness, and an important rule to remember is this: the timing of melatonin is opposite to light. Used incorrectly, light or melatonin can worsen jet lag. For eastward travel, a phase advance is required. This is often the more difficult adjustment. The strategy includes going to bed earlier, waking earlier, and using bright light in the morning. Evening light should be minimized to avoid delaying the clock. For westward travel, a phase delay is required. This adjustment is usually easier as the circadian system of the body is slightly longer than 24 hours. The strategy includes going to bed later, waking later, and using bright light in the evening. Morning bright light should be avoided. The process is called phase shifting, and the most powerful tools we have are light exposure and melatonin. Sleep promotion is especially important during night flights. Help strategies include eye shades, earplugs, or noise cancelling headphones. After arrival, travelers should immediately adapt to the local bedtime and wake time, even if they feel tired. Melatonin can be used when taken at the correct time. It can reduce sleep latency and increase sleep duration. Because responses vary, melatonin should be tested at home before travel. Melatonin receptor agonists such as remelton or tasimelton may also help in selected cases. However, the caveat here is that melatonin in some countries is available over the counter, whereas in other countries it may be restricted or you need a prescription. Promoting wakefulness is sometimes just as important as promoting sleep. Strategies include staying awake until local bedtime, taking strategic naps during flights, and using caffeine carefully. In some cases, stimulating agents like modafinil or modafinil may reduce jet lag severity. To summarize, jet lag is a circadian rhythm disorder. Timing of bright light exposure is the most powerful intervention. The best outcomes occur when behavioral strategies are combined with pharmacologic support and tailored to the direction of travel. Thank you for watching this video. Please like and subscribe, and I would wait for your comments and suggestions.